Welcome to the premiere edition of Gas Talk, Somnia Anestesia's series of podcasts on the smart approach to outsourced anesthesia services.
Welcome to our premiere edition of Gas Talk. This month, we're going to be addressing the topic of anesthesia services in the office-based setting. As many of us know, office-based practices are sometimes stretched really thin and unaware of all of the regulations surrounding their on-site pharmacies. So on hand today to shed some light on this topic from Somnia Anesthesia is Jay Horgan, Manager of Logistics. Hi, Jay.
Thanks, Danielle.
During his 30-year career in healthcare, Jay's done some pretty amazing things, ranging from maintaining meds for hospital ORs and OB suites to doing the same thing for, say, GI practices, podiatry offices, plastic surgery offices, and neurology offices. Joining Jay today is his colleague, Melissa Garcia. Hey, Melissa.
Hello, how are you?
She's Somnia's Senior Director of Operations in the Ambulatory Division, and she also oversees national credentialing for the company. Melissa brings some 18 years of healthcare experience to her position, so between the both of them, they know a lot about anesthesia services in this environment, in the office-based practice environment. So thanks again for carving out some time today to discuss how anesthesia services work in the office-based setting versus, say, a hospital or a surgery center. I would guess that most people don't think about what takes place behind the scenes with regards to anesthesia in those offices. So when we go to a plastic surgery office to get a nip or a tuck, we don't realize what is going on behind the scenes for the anesthesia services there. Or we don't think about the fact that anesthesiologists are responsible for bringing in those medications, those controlled substances that are used to dispense anesthesia in that setting. And I would imagine a contract has to be signed, and there's probably so much more to it that I don't know, and I hope they're going to shed light for us today. So, Jay and Melissa, can you walk us all through how Somnia prepares a medical office for anesthesiologists or nurse anesthetists who support the doctors at those offices?
Sure. Thanks again for having us on today. You mentioned the contract, so before we dig into the meds and supplies and setup piece, I'd like to take a moment to step back and explain what happens leading up to that point. So the first portion of the process, which Jay and I are involved in, actually begins prior to the client contract being executed. What happens is, once our business development team has identified a potential new client, we'll meet internally to review some basics about them and determine if establishing a relationship would be possible based on their needs. You could say we offer a la carte anesthesia services, if you will. So some clients may only want to lease personnel from us, while others want staff, billing services, logistics, and more. So that said, it's important to understand what each client is looking for and how we can best support them and their individual site's needs. So with that, I would speak with our ambulatory scheduling team to determine if we have or will have sufficient staff to provide coverage to the client within their requested time frame. A client might want to start in 60 days, 90 days, or next week. So we really have to adjust our process and parameters to accommodate the client. If we don't have sufficient staff, I would then consult with our recruitment team about clinicians in our database or current pipeline that might fit the mold. So if we feel we can fulfill the client's needs, then Jay and I would coordinate a time to visit the facility and we perform a logistics evaluation. That is done regardless of the type of services the client's looking for. So we really make sure that we're meeting all the current standards of care and we cover all our bases. We basically go in and assess their procedure rooms, operating rooms, pre- and post-op areas, equipment, and like I said, we'll make sure everything is up to snuff. So only after they've completed that evaluation would we then extend a contract to the client. So there are a lot of bases to cover before we, get boots on the ground and see what's happening within their space. So Jay, could you elaborate a bit more now about what you and your technicians specifically look for during those evals or when you're setting up a new client?
Sure, thanks, Mel. There's a lot of moving parts to going to a office-based setting. So when we go in and do our site evaluation from a logistics perspective, number one, we have to see what type of service they're going to be providing. Is it going to be urology, plastic, GYN, GI? And we also need to know how many rooms we're going to be covering. This way we have a better idea of how we're going to set up that particular office. Certain setups are more complex than others. Obviously, a plastic office that may require an anesthesia machine is more complex than an office that may be just doing GI services.
So I guess they're customized. You do a different setup for each type of client?
That's correct, Danielle. So if a office, for instance, is geared towards plastic, then we would have a plastic inventory sheet that's tailored just for what they need in that office. It could be anywhere from a plastic office to a GI office to a urology office. It's based on how many cases they do, their volume, and any specific needs that office may have.
Do you start with the basic kit? What's in it?
So the cart itself would be built here in Somnia in headquarters. We are also a New York State licensed pharmacy here, and we could build a cart here, and then once we get it tailored to exactly what they're going to have, we then relocate the cart from the headquarters to the office-based location. And once we're in the office location, we can determine then exactly what days a week we're going to be covering that office and the days that are going to be best for us to go in and replenish the office for supplies, meds, and to check all the equipment.
So what types of equipment are there?
So in an office, we usually put it'd be a standard anesthesia cart. We have a Banyan kit, which is almost a mini crash cart. Such equipment would be an oxygen concentrator, a defibrillator, a multi-parameter monitor, portable suction, O2 tanks. There's a host of equipment that goes in there for what would be required for anesthesia care.
Who does that? Do you have to go to all these clients?
So once Mel and I do the initial site evaluation and we determine the best days of the week that we can go in and do a setup, we have logistic anesthesia technicians that will go to an office, do the initial setup, and they'll maintain that office depending on how frequently they're going to work and the best days of the week we can get in there without disrupting their office when they're seeing patients.
There must be regulations around what you do. What are they?
Yeah, so Somnia goes by the ASA guidelines as well as they follow the Quad A, AAA, or Joint Commission guidelines. Here in New York, all offices have to be accredited, so we take our safety to the highest level. That's a priority for us here at Somnia to make sure that everything is top-notch.
So you mentioned accreditation. Do you help all these clients with their accreditation? Are they already accredited when you get there? How does that work?
So sometimes yes, sometimes no. Being accredited is a requirement in New York State for these offices. So if it's a brand new client setting up a new office from scratch, we can offer some consulting services and help them to get accredited and then provide the anesthesia to follow. If they're already accredited, then we'll go in. Jay and I stay in contact with them, and I actually manage all of the accounts once they're brought on. So I know when they are preparing for a survey and when their survey date will be. Jay and I will go in, we'll do a mock survey with one of the technicians and help them, look for things that we know the surveyors will be keeping an eye out for that they might not be aware of, common areas of deficiencies, things like that. So we do support them, do that mock drill, and make sure that they're ready for the live date.
So, Jay, would you say most of these offices are prepared, or do you have to do a lot of work?
Mostly they're prepared, and they're more than happy to see us come in as we're an extra set of eyes for them. We look for things such as expired meds and safety plans and privacy policies and things that are most helpful to them getting prepared for their reaccreditation. So we're good at what we do. We've been doing this for a long time, and many times the offices are more than happy to have us come in and spend some time with them.
Great. How did they get their start?
And actually, that's a good question because Dr. Mark Koch and Dr. Rob Goldstein, the founder and co-founder of Somnia, they had this vision some 21 years ago, and they decided to start this practice by having anesthesia in a bag, so to say. So they were the pioneers in providing anesthesia in an office-based setting, and they've been doing this for quite a long time. Since then, they've got involved not only in office-based anesthesia, but they do AMP-Surg settings, and they do hospitals throughout the country. Their vision has really evolved to what we are today. We're a premier national anesthesia provider.
Yeah, it's pretty amazing to think that it started with just the two of them. Supplies in hand, going to the offices themselves, and now we have, close to 600 anesthesia clinicians around the country.
I know. And when you go to a doctor or a surgeon or you're going to have something done, most people don't think about who the anesthesiologist is.
No, they don't. They think it's, part of that practice.
Yeah.
It's as one unit. They don't realize that it's separate and everything that goes on, like you said earlier, behind the scenes to get to that point.
Right. It meshes. It seems to be one unit, even though it's from a separate company. Well, thank you both for spending some time with us today and for shedding light on what really happens behind the scenes regarding anesthesia in office-based settings.
You're welcome. It's great to
thank
be
you.
here. Thanks for having us.
Thanks for listening to the premiere edition of Gas Talk. Check out somniainc.com/gas talk for more information about outsourced anesthesia services or to listen to past episodes.